Zika has really a couple of different elements there. One is that the place where the problem has been most intense is where the mosquito vector is in greatest abundance. So in tropical and subtropical countries, Brazil, Colombia, the countries of South America, Central America, in the U.S. right now, in Puerto Rico, the Virgin Islands, American Samoa, intense transmission. We don't have mosquito-borne transmission to this point in the United States, but we're preparing for the possibility of isolated transmission, similar to the way that dengue and chikungunya have been identified in the U.S. We were part of that original recognition of the association of the birth defect with Zika virus infection. In January, in the laboratory, we examined brain specimens from fetuses that had died of Zika virus and saw evidence of virus infection in the brains of children that had died. Within 72 hours, we had issued guidance for pregnant women to avoid travel to countries that were having Zika virus infection. So the first thing is really individual measures for women who are pregnant or who might be pregnant to avoid that's really kind of the bottom line is for pregnant women to avoid Zika virus and to be protected against Zika virus. So there are individual measures, travel being one of the main ones right now. For people who are living in those areas where you can't avoid the vector, individual mosquito avoidance measures, so insect repellent, long sleeves, and long pants to avoid being bitten by mosquitoes. At a larger level, vector control measures, which can either be at a household level or a larger level. There's a lot of things that can be done in working on the evidence base for which are most effective. So we know how these mosquitoes breed. It requires very little water. So removing debris that could harbor small amounts of water is a key measure. There are larvicides, things that kill the larvae of the mosquito that can be effective. There are methods to kill adult mosquitoes with insecticide that can be done with very low volumes of insecticide, so that's something that's being examined as well. At this point, for places where the mosquito vector is active, all measures to prevent pregnant women from becoming infected, or that's what we're trying to do, and then sorting through which ones are most effective so that we can put the most effort where there'll be the most value. Another individual measure to protect pregnant women is for their significant others to use condoms. And it's not for birth control, but for the barrier protection in case the partner is infected to prevent the sexual transmission to a pregnant woman.